Now, I just had someone came in and wanted my opinion on rib surgery. Now, the rib was taken out due to cancer, and I've had this before. Either the cancer's in the lungs or the cancer's in the ribs, and they've got to remove the ribs and then a lot of the intercostal muscles and the back muscles to facilitate the surgery and taking the tumor out. However, I don't think people realize what it does to structure, and I have quite a bit of experience on it, and I just wanted to go over sort of what happens on the body. When you're working with any kind of scoliosis, well, people think that scoliosis is always neurological. One of the ways I present is a lot of times it's structure. Bad feet, hips, so forth can cause a scoliosis. The spine is meant to be able to be more neutral on its movement, right? So when we're here with all of this, and he's kind of rigged up. He's not rigged up properly because the movements of the spine should be with counterbalance. So when they take out the rib here, that's one thing, and that's what people hear. But you don't realize, first of all, each vertebrae, the muscle-based structure will counter. I really look at the spine as fine motor skills. So then they're taking out, there's muscles in between each rib. But we were made a certain way for a reason. So when we're moving and all of that, so when you're approaching your first lesson with the scoliosis course, you're really going to want to take care of where I talk about working across the vertebrae, right? But you're also going to want to take care that each rib starts to counter within each of their vertebrae, right? So please don't look at flexion and flexion with the spine. The spine does not go this. It needs a 360, right? Same with my hands. My hands can do this because my spine can do this. And so that's where I would start looking at this as an additional information if you're doing the scoliosis course. I'll put the link in below just so you see that, but really what happens when the care is not there, see, each rib is supporting the health of the vertebrae. So let's think of the spinal column, fine motor skills, and it goes through the body. And now each one of these ribs has its job. It distributes that weight. So when you have not brought in that weight distribution back neurologically into the system, what starts to happen is the collapse. And the client will tell you literally, and it's more advanced stuff. This isn't necessarily stuff you can do at home, but at the same time, times have changed and we're going to home. But really, your best lesson is going to be with a practitioner. But still, you don't have that spinal support. It literally collapses because they've taken out so much of the intercostals. And so what happens is if I go to bend to the other side, there's no accordion. So when I come back and I fall. And that's where then the collapse starts. It's so I'm going to do this on myself now. So if I'm just here, right, and I decide I'm going to pick something up, but I've had this surgery, what happens is, see, normally my ribs weight transfer so I can do all these movements, but I come here, right, and I come back and I fall. And then that's where the scoliosis starts to hit. After surgery, you're weak. After surgery, you're frightened. I get it. Again, people are trying to save your life. There's still psychological effects of all of that. You're going in for major scoliosis surgery. Please consider doing the course first. If anything, just to prep. There's not a lot of blood flow into some of the spine. And that recovery, and you want to be able to have that touch there for your child. So afterwards, when you do have to do some kind of therapeutic, and I hope I'm involved in that you're going to take that into consideration. So thank you very much.